Hello everyone, so this video is going to be about cardiac tamponade. Cardiac tamponade is defined as collection of fluid within the pericardial sac. This collection of fluid within the pericardial sac impairs the filling of the ventricles and the heart with the blood. And this impairment of filling of heart disturbs the blood pressure, and we can see the signs in JVP as well as auscultation, as well as the clinical feature of the condition that is causing cardiac tamponade. So actually in cardiac tamponade, we will have an intrapericardial pressure of more than 15 mm of Hg. No matter how this intrapericardial pressure is reached, that is of 15 mm Hg, if it is more than this, the intrapericardial pressure will reach more than filling pressure in heart. And then the ventricular filling will be impaired, leading to the symptoms of cardiac tamponade. This intrapericardial pressure reaching more than 15 mm of Hg depends on amount of fluid that is getting collected in this pericardial sac. Also, it is important that how rapidly this fluid is getting accumulated, as well as compliance of the pericardial sac is an important factor. So these were basic physiologies understanding the cardiac tamponade. We need to understand the causes for cardiac tamponade too. Acute causes may include a chest trauma that may lead to collection of blood as well as air into the pericardial sac, or post-MI free wall rupture can lead to collection of blood within the pericardial sac. And aortic dissection is an important cause that can lead to cardiac tamponade with certain contraindication we will learn further. Chronic causes may include neoplastic or metastasis changes, and TB is an important cause for cardiac tamponade too in the long run. Let's understand a classic Beck triad that is seen in case of cardiac tamponade. So Beck triad has three features. The first one is decreased cardiac output, increased JVP, and muffled heart sound. We'll start with the basic, that is decreased cardiac output. We already discussed that increased intrapericardial pressure is going to impair the ventricular filling. Because of this increased intrapericardial pressure, the ventricular filling is impaired. This will decrease the end diastolic volume in the ventricles. As well as due to this decreased volume, end diastolic pressure will be decreased. According to Frank-Starling law, if the pressure is low, the stretch of the myocardium will be less, and if the stretch is less, the stroke volume will be less. So if the stroke volume is less, we know the cardiac output will become low, and as the cardiac output is low, the systolic blood pressure of the patient will be low. So a patient of cardiac tamponade will have decreased systolic blood pressure as well as decreased cardiac output, and this decreased cardiac output will go to patient, leading to reflex tachycardia as well as reflex tachypnea. So when understanding Beck's triad and saying we have decreased cardiac output and decreased systolic blood pressure, we must know the patient also has reflex tachycardia and reflex tachypnea. The second feature is about JVP becoming elevated. Since the filling pressure is very high, the JVP is going to remain elevated, and also because the pressure in the ventricles is going to be high from early diastole, the Y descent will not be seen. The Y descent is seen when the ventricle relax and the filling goes on. Okay, but in this case, because of the pressure in the ventricle is high even at the start. Okay, so if these are the ventricle, this is the ventricle. So this is the ventricle. So the first wave is A wave, which occurs when the atrial systole occurs and the pressure in the atria rises, manifested as rise in JVP, that is the A wave. Then the atria start relaxing, we have the C wave, and the blood column comes down, we have the C wave. And then we have the Y descent. Okay, we have the V steep, that is because of the ventricular systole, means A followed by C. Then we have the V, that occurs because of ventricular systole, and then because again of the ventricular filling, we have the Y descent. Okay, so let's understand it again. We had the A rise in the JVP because actually JVP is telling us about the column of the blood in the internal jugular vein. So as the atrial systole occurs, the blood column rises up, that is the A wave. As the atria start relaxing, we have the C wave, and the blood column comes down, we have the wave coming down. Again we have the ventricular systole leading to a V wave. that is manifested as above blood column in the JVP. And then again we have the Y wave, that is because of ventricle start relaxing and the blood column starts coming down. But in this case, because of cardiac tamponade, we have increased pressure in the ventricle from start of the diastole itself. So ventricle will not relax and the Y descent will not occur. And this is what I seen, the loss of Y descent in case of cardiac tamponade. Not only this, we have a sharp X descent because of high pressure from above that is going to fill the ventricle with rapidity in the start. So two features in JVP we need to remember is not only JVP is elevated, we have loss of Y descent and a sharp X descent. The third feature is muffled heart sound. This is because of pericardial sac having lot of fluid, the sound waves are not transmitted, and on auscultation we have muffled heart sound. So remember, this Beck's triad is characteristic of an acute tamponade. So patient developing a tamponade following chest trauma, post-MI free wall rupture, aortic dissection will present most of the times with Beck triad. But in case of chronic tamponade, the patient will have features of congestion on both the sides, systemic as well as pulmonary. This is because the heart is going into ejection failures. Okay, because of this intrapericardial pressure rise, later on the patient will have congestion on the pulmonary as well as the systemic side, and patient will manifest with a lot of symptoms. Okay, plus patient will have symptoms of the associated feature of the condition, like if the patient has chronic TB, the patient will manifest with it, as well as if the patient has neoplasm or metastasis of certain places like SCC of the lung presenting with hemoptysis, long cough. Okay, these may be the features. So these were the clinical features. Let's go on and understand some other things. That is, it is also associated with pulsus paradoxus. Now what actually is pulsus paradoxus? So we have this heart. This is the right side and this is the left side, and this is our pericardial sac. So what actually happens in case of inspiration? During inspiration, the intrathoracic pressure becomes negative, and this negative pressure is transmitted and the venous return to the right side increases, as well as the pulmonary compliance increases, so the right side filling decreases. Okay, sorry, left side filling decreases. This is normal phenomena, that during inspiration, because of decreased intrathoracic pressure manifested to decrease intracardiac pressure, venous return to the right side increases and to the left side filling decreases. This leads to deflection in the free septal wall. This deflection in the septal wall does not lead to any changes because of the free wall of the left ventricle can distend. This is a normal thing and there will be no change in the outputs seen, and the outputs will be less changed. But in case if the patient has pulsus paradoxus, if consider a condition, if the patient has cardiac tamponade, if the patient has tamponade, this free wall of the left ventricle cannot distend to increase the volume of left ventricle when the inspiration occurs. So in this case, when inspiration will occur, venous return to the right side will increase and to the left side it will decrease, but the septal wall will so let's understand it again. So we were saying that if this is the heart, okay, and we have this right side and this is the left side, during inspiration the intrathoracic pressure becomes negative. This negative intrathoracic pressure is transmitted to the heart, so there is negative intracardiac pressure. Because of this negative intracardiac pressure, the right side receives more venous return. This is normal phenomena in case of inspiration, and the left sided filling decreases normally. And also during this phase, because of right-sided filling increasing, the septal wall deflects to the left side. But this does not decrease the stroke volume because the free left ventricle wall can distend. And the stroke volume does not increase or decrease to a lot of limits. It is within the physiological limits. But in case, consider a situation like cardiac tamponade or restrictive diseases of the pericardium. This will lead to deflection in the septal wall, but the free wall of the left ventricle will not distend. So the volume of left ventricle cannot increase, and this will result in decrease in the stroke volume, as well as decreased stroke volume will decrease the cardiac output and decrease the systolic blood pressure. This is what we are measuring in pulsus paradoxus. That is, during inspiration, the systolic blood pressure is going to fall more than 10 mm of Hg. This is what is pulsus paradoxus. It can also be seen in restrictive airway diseases like asthma and COPD, as well as pulmonary embolism. Investigation in case of cardiac tamponade are 2D echo and ECG. ECG will show classical electrical alterance. That is, because of this dangling vector of QRS complex, we are going to see different voltages of QRS complex in lead 2. The treatment include therapeutic subxiphoid pericardiocentesis. Okay, the details of which will be discussed in another video. Also, you need to remember that contraindication to this subxiphoid pericardiocentesis is aortic dissection, because in that case, if pericardiocentesis is done, it is going to worsen the condition. In recurrent cases, we are going to do, means in cases of metastasis or TB, we prefer making a pericardial window or doing pleurodiosis or pericardiectomy. In pleurodiosis, we are going to use chemicals like tetracycline, which are going to fuse the pericardial layers. So these were bits about cardiac tamponade. Hope you liked it. Thanks for watching.